Hello, my name is Savannah Leggett and I'm a paramedic at Johnston County EMS. Today I'm going to teach you how to do CPR. CPR stands for Cardiopulmonary Resuscitation, and it allows us to manually pump blood through the heart when it's unable to do so for itself. This is what CPR looks like. Hey, can you hear me? Before approaching any patient, we want to check our scene to make sure we are safe to provide care. This can include looking for dangers such as environmental hazards like fire or water, or situational hazards like unsafe people or crowds. It's important to be aware of things that can become unsafe in our scene if left. For example, any item can become a weapon if you're willing to use it that way. Even after caring for a patient, we should leave the scene if it becomes unsafe. This would also be the appropriate time to apply personal protective equipment, or PPE, such as gloves. So when do we perform CPR? CPR is performed when a person's heart has stopped beating, meaning that the person has died. We call this cardiac arrest. The first indication we're looking for to start performing CPR is a loss of consciousness. This is when a person suddenly goes unresponsive in front of you, or you come across an unconscious person. We check for consciousness in a variety of ways, including speaking or yelling at the patient and performing a sternal rub. This may look like this. Hey, can you hear me? The second indication to start CPR is pulselessness. This tells providers that the patient's heart is no longer beating. In cardiac arrest, we check for a pulse at the carotid artery on the right or left sides of the neck. To do this, we press 2 fingers into the neck at the side, a little bit of back from the hard windpipe you feel at the front of your neck. We'll check for a pulse for 5 to 10 seconds. On a patient, this will look like this. The last indication that we should start CPR is checking for breathing. We do this by looking and listening. We look for the chest rise and fall, and listen for breaths coming in and out of the patient's airway. It would look something like this. Some patients may have agonal breathing, which is gasping breaths with an extended time in between. This can be 30 to 60 seconds. When the patient has agonal breathing, we should still start CPR. When determining if a patient is breathing, we may need to readjust the airway. To do this, we use the head tilt chin lift method. This involves pushing the patient's forehead down and lifting their chin. Most of the time, we do these actions at the same time to save time. In a cardiac arrest, it's important to start CPR as quickly as possible, so we perform all 3 of these checks simultaneously within 5 to 10 seconds of reaching a patient. This might look like this. Hey, can you hear me? Now that we know when to perform CPR, we can learn how to perform CPR. We first start by identifying the right location. To do this, it's best to remove the patient's clothing if possible. We perform CPR on the lower portion of the sternum or breastbone. The sternum is the long, hard bone that runs down the center of the chest, and the lower portion, or lower 1/3, is typically at nipple line for the patient. To perform CPR, we place one hand over the other and intertwine our fingers like this. We place our hands on the lower portion of the sternum and we press hard and fast. The best way to do this is to keep your arms straight and bend at the waist. You press down 2 or more inches into the chest. We call this a chest compression, and it looks something like this. No matter the age of the patient, we do chest compressions at a rate of 100 to 120 beats per minute. You can use a metronome or a fun sound to get the rate right. Some songs with the appropriate rate include Staying Alive, Another One Bites the Dust, Pink Pony Club, or even Baby Shark. While doing chest compressions, it's important that we let the chest fully expand in between each compression. For example, if I were to crush this BVM and not let it expand back, there's no more air for me to push out. Same thing happens with the heart. When we crush the heart, we push the blood out, and if we don't let blood pull back in, we'll have no more blood to circulate. If you are the only provider, you will complete 30 chest compressions before you break to provide 2 breaths. You provide breaths by first adjusting the patient's airway, like we talked about before, using the head tilt chin lift method, and then you can either use a bag valve mask or BVM, or a barrier mask. Looks like this. For both masks, we'll use the EC method, or CE, to ensure we get a good seal on our mask. Barrier masks, like these, can be found in AED kits, or some providers choose to carry them on their own. If you do not have either mask, it is acceptable to provide chest compressions without breaths until additional help can arrive. This is what breaths look like with a BVM. When doing this, we'll look for chest rise and fall, just like we did when we were checking for breathing. If we have a barrier mask, put the mask on the patient's face, again using the EC method, and we'll blow into the hole. If there is more than one provider available, one provider can oversee chest compressions while their partner focuses on providing breaths. Now we can put all this together and see what CPR looks like in full. Hey, can you hear me? Now that we've learned how to do adult CPR, let's talk about child or pediatric CPR. For CPR, a child or pediatric is considered anyone between the ages of 1 and puberty, which is typically 8 to 13 years old. Child or pediatric CPR is a lot like adult CPR. We still check for consciousness, breathing, and a pulse. To check for a pulse in a child, we still use the carotid artery with 2 fingers. For children, we still do compressions at the same place, the lower 1/3 of the sternum, but the hand position is going to be different. For children, especially smaller children, we're going to use one hand in the center of the chest without our second hand. Still going to be straight, still going to be bending at the waist, and we're going to press down 1/3 the depth of the chest, which for most children is still approximately 2 inches. For children, we do compressions at the same rate, 100 to 120 beats per minute. With one provider, we also use the same ratio of 30 chest compressions to 2 breaths. However, when there are 2 providers present, we switch to a rate of 15 chest compressions to 2 breaths. Breaths are performed the same way, just with a smaller mask. When we put it all together, child CPR looks like this. Hey, can you hear me? The last category of CPR we will discuss is infant CPR. Infants are considered anybody under the age of 1. For infant CPR, we don't check for consciousness by doing a sternal rub. Instead, we tap the shoulders or the bottom of the feet like this. Another change or difference in infant CPR is that we no longer check for a pulse at the carotid artery. Instead, we use the brachial artery, which is in the upper part of the arm. We do this by taking 2 fingers and pressing it about 1 inch to 2 inches above the elbow. In a baby, it looks like this. Also, unlike adults and children, we start CPR if an infant's pulse drops below 60 beats per minute. In infant CPR, we use one of 2 hand placements. We can either press on this lower part of the sternum with 2 fingers, like this, or we can take our hands and encircle the infant's chest and press using our thumbs like this. Compressions on an infant should still be at the same rate, 100 to 120 beats per minute, but should be between 1 and 1.5 inches deep, or 1/3 of the chest depth. Like children, we change the ratio from 30 compressions to 2 breaths to 15 compressions to 2 breaths when 2 providers are present. Additionally, we have an even smaller mask for babies. When we put it all together, infant CPR looks like this. Hey, can you hear me? In all patients, we should continue doing CPR until the patient regains a pulse or we are directed to discontinue. Some good reasons to discontinue CPR include extended downtime of the patient and if the scene becomes unsafe. If a patient regains a pulse, we refer to that as ROSC, or return of spontaneous circulation. It's appropriate to check for a pulse every 5 rounds of CPR, or 2 minutes, for no more than 10 seconds each. When performing CPR, there are some special things to consider. If you are performing CPR as a bystander and not as an EMS provider working with an agency, you may need to call 911 or obtain an AED from a nearby location. If the patient has an unwitnessed arrest, it is best to do 2 full minutes or 5 rounds of CPR prior to obtaining an AED, but contact 911 at your earliest convenience. Additionally, it's best to do CPR on a hard surface and never when somebody is sitting up. If you find an unresponsive person in a chair or on a bed, move them to the floor first. This includes taking infants out of cribs. In the case of trauma patients, it's unsafe to do a head tilt chin lift method because we are concerned about their C-spine or cervical spine. In cases of trauma patients, we'll use the jaw thrust method where we take both of our thumbs, put them underneath the jawbone and lift up.